Hello everyone, I'm HUMA QURESHI and I welcome you to our special health series, Aapke Liye, wherein we dive into conversations around everyday health concerns that often get overlooked, and one such issue that affects millions of people, especially women, but often goes undiagnosed or ignored: anemia. If you've ever felt unusually tired, dizzy, please don't ignore, as this might be something worth paying attention to and help us understand what anemia really is and why it matters. I'm joined by an expert who will walk us through the science, causes, and most importantly, what we can do about it. Doctor, please help us understand what iron deficiency anemia is and how common it is amongst Indian women, especially during pregnancy.
Thank you for inviting me in this podcast. I am Dr. Rajesh, consultant gynecologist. Today I am going to discuss regarding the iron deficiency anemia. Iron deficiency anemia means the body doesn't have enough iron to make healthy red blood cells. Without enough iron, blood cannot carry enough oxygen, which makes you feel weak and tired. In India, this is very common, and almost 1 out of 2 women have some degree of anemia, especially during the reproductive age and pregnancy.
So what is the ideal hemoglobin level for women both during pregnancy and otherwise? And what are the main causes of iron deficiency anemia in both these groups? Do the risk factors differ?
In India, iron deficiency anemia is very common. For a healthy woman, actually hemoglobin level must be above 12 gram per deciliter or above. But we see in the pregnancy, the hemoglobin level is lower than 8, 9, sometimes it is less than 7. And this is the most crucial thing in our country.
So what are the signs and symptoms of iron deficiency anemia during pregnancy, and how does it affect the mother and the fetus?
In pregnancy, the body's need for the iron increases because iron is necessary for both mother and baby. If this need is not met, then iron deficiency anemia develops. The signs and symptoms are tiredness, weakness, fatigability, pallor in the skin, lips and nails, dizziness, frequent headache, palpitation, respiratory distress, and in severe cases, sometimes the swelling in feet and sometimes fainting occurs.
So does the Indian diet meet the increased iron needed during pregnancy, and what are the possible detrimental effects of anemia on the mother and fetus?
The actual Indian diet is often rich in cereals but low in iron-rich foods like green leafy vegetables, pulses, jaggery, nuts, and meats. Also, many foods in India, our diet, like tea and coffee, reduces the iron absorption. So, diet alone usually can't meet the high iron requirement of pregnancy, and the effect on the mother is so adverse. More fatigue and poor ability to work, higher chances of complications like preterm delivery or excessive bleeding during the childbirth. Effects on the baby, poor growth inside the womb, preterm delivery, low birth weight, and sometimes there is a risk of fetal death inside the utero, and that is very uncertain. Iron tablets are very important in pregnancy but can sometimes causes some side effects. Actually, the common side effects are constipation, hard stools, stomach pain, cramps, black stools, nausea, and vomiting. But you can reduce the side effects by following some tips and tricks, like take the tablet after a meal, not on an empty stomach. Drink plenty of water and eat fiber-rich diets to avoid the constipation. If one type of iron tablet is not suitable, you can change the iron preparation. Patient can use iron syrups, and sometimes in severe cases, we can advise the injections. Iron injections also very fruitful. It will reduce the anemia very fast, and it is also very effective.
Thank you, doctor, for sharing your valuable insights and guiding all of us on anemia and its management for better outcomes. Thank you.